This video will focus on the credentialing portion of the FTCA Deeming Application, Supplemental Information, and ECRI Institute resources. On this slide, you'll see a screenshot of the Clinical Risk Management members website that contains guidance articles, sample policies and tools, toolkits, courses for continuing medical education credit, self-assessment questionnaires, and other resources that you can download and use in your health centers and free clinics. Clinical risk management resources are made available by ECRI to you for free on behalf of HRSA. Throughout this instructional video, we're going to be discussing some best practices that will assist you with preparing the required materials for the credentialing portion of the FTCA Deeming Application, but we're also going to be referring to resources that are available on the Clinical Risk Management website that can help you. These sample policies and resources are not required, but rather information that you can review and utilize if you feel it is a good practice that should be implemented in your health center. If you are using the policies and resources mentioned in the video, you need to make sure that your health center is actually implementing them and that the resources used are tailored and appropriate for your health center. Before you begin filling out the credentialing section of the application, you'll want to make sure you have a copy of your health center's credentialing list in an Excel spreadsheet, which we'll show you more in a minute, and your health center's credentialing and privileging policy with board signature and approval. You'll need to attach these documents to the application. If your credentialing and privileging policy does not include the board approval on the actual document, you can also submit board minutes that clearly show that the board approved the policy and include the board signature and date. This is new for the calendar year 2013 application. You'll need to submit the minutes in addition to the policy, not in place of. You should also refer to HRSA Policy Information Notice 2002-22, which includes comprehensive information on HRSA's requirements related to credentialing and privileging, and HRSA Policy Information Notice 2001-16. Finally, you'll want to refer to the most recent HRSA Program Assistance Letter on FTCA Medical Malpractice Coverage Requirements, PAL 2012-02, and a link to the PAL is on this slide. These next few slides list the questions you'll need to answer for the credentialing portion of the application. You will need to upload your credentialing list and credentialing and privileging policy to the application. For other questions, you'll need to either verify that you have particular procedures by clicking on yes or no, or describe your procedures. According to HRSA requirements, all health centers must assess the credentials of each licensed or certified healthcare practitioner to determine if they meet health center standards. This policy applies to all health center practitioners, or employed or contracted, volunteers and locum tenens at all health center sites. HRSA also requires that health centers maintain a list of these credentialed providers. This list must be an Excel spreadsheet and must include the required information listed on the slide. Also included on the slide is a sample spreadsheet, so you can use the same format when developing your credentialing list. Again, you'll need to upload your list to the application to submit it to HRSA. In past years, HRSA required that a column for initial credentialing date on the credentialing list was also included. However, for the calendar year 2013 application, the initial credentialing date is no longer required. The current credentialing date on this list must be within the past 2 years. If it is not, your application will not be reviewed and it will be returned to you. Applicants will also need to upload their credentialing and privileging policy to the application, and this policy must include the signature and date of the board and the date the policy was approved. You should take a hard copy of your policy with the actual signature, scan it to your computer, and then attach that document to make sure the actual signature appears on the document. The first image on this slide represents what the signature on the policy should look like. Your policy should not have any blank dates or signature lines and should not have the typed signature of the board of directors. The last two images on this slide with the X through them represent what you should not do. One thing that is new for the 2013 application is that if you don't have this board signature and date on the actual credentialing and privileging policy, you can, in addition to uploading the policy, also upload your board meeting minutes that clearly show that the board approved the credentialing and privileging policy. These minutes must then include the signature of the board and the date of approval, and like that policy, the hard copy of the minutes should be scanned to your computer, and that copy should be uploaded so you have the actual signature on the document. Now that we've covered the formatting for submitting applications, we'll go into what should be included in your policies and processes based on the requirements in the Policy Information Notice 2002-22. A great majority of requirements in the PIN are discussed in the remainder of these slides, However, there are many other elements and details that are not outlined in these slides. Therefore, the health center should make sure to review the policies completely. Credentialing involves evaluating a practitioner's eligibility to provide clinical services at the health center and evaluating the provider's competency for specific clinical privileges. Investigation, review, and ongoing evaluation of a provider's skills, education, and experiences through well-developed credentialing processes can safeguard patients, improve quality of care, and minimize liability. Failure to do so may result in liability if a patient is harmed on the theory that the employer knew or should have known that the provider was incompetent or lacked adequate training and experience, making it foreseeable that his or her performance would be below accepted standards of care. HRSA requirements state that health centers must assess the credentials of all licensed or certified healthcare practitioners, including employed, contracted, volunteers, and locum tenens practitioners at all healthcare sites. This requirement must be clearly stated in policies and procedures on credentialing. HRSA requirements state that provider credentials should be renewed at least every 2 years. However, health centers should not wait for those 2 years before reviewing an individual's credentials. Health centers should review and evaluate the care provided by each credentialed provider on an ongoing basis to ensure that competence is maintained and is consistent with clinical privileges. A sample credentialing and privileging policy is available on the Equity Institute Clinical Risk Management website as part of the credentialing toolkit. A link to the sample policy appears on the slide. The definition of a licensed or certified healthcare practitioner is listed on this slide. Licensed or certified healthcare practitioners can be divided into 2 categories: licensed independent providers who can practice without direction or supervision, such as physicians, dentists, nurse practitioners, or nurse midwives, and other licensed or certified practitioners who are not permitted by law to provide patient care without direction or supervision, such as laboratory technicians, social workers, medical assistants, registered nurses, licensed practical nurses, or dental hygienists. It is up to the health center to determine which staff members qualify as independent licensed practitioners or other licensed practitioners, and which specific staff members qualify for each category should be clearly stated in the health center's credentialing process. The distinction between these 2 providers is important when determining whether to use primary or secondary source verification, which we're going to discuss. Primary source verification involves reviewing the original source of a specific credential. So, for example, this could include direct correspondence with an educational institution or healthcare organization, correspondence by telephone or internet, reports from credentials verification organizations, or checking databases such as those listed on the slide. Verification of licensure, education, registration, training, and certification for licensed independent practitioners must be from primary sources. The requirements for other licensed or certified providers are a little less strict. Verification of licensure, registration, and certification needs to be from a primary source, but secondary source verification could be used for most other credentials. Secondary source verification can be from sources other than the original source, such as photocopies of documents. So, for example, providers may submit copies of their picture identification because the requirement state verification may be from a secondary source. Copies of Drug Enforcement Administration registration cards can also be submitted. These tables are from PIN 2002-22, and they outline which cases require primary source verification and which require secondary source verification. This table on the left-hand side covers source verification for credentialing. So as you can see, for a licensed independent practitioner, such as a physician, nurse practitioner, or dentist, you need primary source verification for verification of licensure, education, training, and current competence, a confirmed statement for verification of health fitness, governing body approval authority, and secondary source verification is okay for areas such as picture identification, immunization status, and Drug Enforcement Administration registration. For other licensed or certified practitioners, such as registered nurses or dietitians, secondary source verification is okay in most cases, except for verification of licensure. Moving over to the other table on the right-hand side, types of verification required for initial granting of privileges and renewal or revision of privileges are covered here. When you are verifying the credentials of your practitioners, go back to this table, either here on this slide or in HRSA's PIN 2002-22. Make sure you're using primary or secondary source verification according to these requirements. Make sure these requirements also also clearly outlined in your policies or procedures. You'll want to make sure you are aware of timelines and due dates and that you start the credentialing process promptly to make sure you have enough time to collect all necessary information. The credentialing process can take about 30 to 90 days to complete. A helpful way to ensure that all necessary information is completed and returned to the health center is to create a checklist of the items that you need and use a paper or computer tracking file to check off when items are returned. Make sure you have an accurate email address or contact information for the provider, and tell them to check their email so you can quickly communicate with them if there is any additional information that you need. For all verifications, make sure you have accurate and complete proof of dates and documentation. HRSA will look at dates to see if credentialing and privileging was completed prior to the provider beginning work at the health center. So for example, if you're calling an educational institution, document the dates of any calls, the times of the call, the person at the institution who you spoke with, and any follow-ups. Scan any dated envelopes and make sure computer printouts have dates documenting when the document was printed out and verified. A sample timeline that health centers can use to document that the information was returned and when it was returned is available on the Clinical Risk Management website at the link listed on the slide. Each practitioner should be privileged specific to the services being provided at each of the health center's delivery settings. You'll need to verify on the FTCA Deeming Application that you do this. Privileges should be reviewed and renewed at least every 2 years. However, like credentialing, you'll want to make sure that you evaluate the provider's performance related to clinical privileges on an ongoing basis rather than just every 2 years. You can go back to that previous slide that we looked at that had the table of primary and secondary source verification to see the requirements for privileging. Question 9 on the FTCA Deeming Application is a 6-part question that pertains to the health center's peer review processes. Peer review processes are quality improvement processes that improve the overall quality of clinical care. The goal of peer review is listed on the slide. Health centers should connect peer review to credentialing and privileging. Obtain information on physicians from primary or secondary sources when appropriate. This due diligence will help filter out potentially troublesome physicians before they get into the health center. Keep notes about disciplinary actions in the credentials file. The questions on the FTCA application address these last areas listed on the slide under what your policies should address. It's important that you address each of these areas in your policies. One note about maintaining patient confidentiality is that almost all states have enacted statutes that give information maintained for peer review some degree of protection from discovery. Because peer review statutes were typically enacted to address peer review as conducted by hospital medical staffs or other formal review processes, health centers should ensure that peer review as conducted in the facility meets statutory requirements. Health centers should consult legal counsel who thoroughly understand state statutes and relevant court decisions in the jurisdiction, and should establish policies that satisfy legal requirements for discovery protection privileges. A good way to look at peer review is in the context of developing strategies for improvement is to look at it as an educational process, not a disciplinary one. The intention of peer review is to improve patient safety and the overall quality of care. I'll make a quick note about maintaining credentialing files. It is important that you maintain complete and organized files for each provider related to credentialing and privileging information. Unorganized and incomplete files make it difficult to determine if appropriate implementation and compliance has taken place. If HRSA comes to your health center for a site visit, they will be looking at your credentialing files to make sure that they're organized and complete. For tips on organizing your files, refer to the Guide for Preparing Files for an FTCA Site Visit on the Clinical Risk Management website at the link that's on the slide. Throughout this video, we've been referring to resources from the Credentialing Toolkit available on the ECRI Institute Clinical Risk Management website. Again, access to the website is provided to you for free on behalf of HRSA. In order to access the Clinical Risk Management website, go to the address listed on the slide, www.ecri.org/clinical_RM_program. You'll need to log in with your username and password. You can see the red circle on the slide where you would enter your login information. If you don't yet have a username and password, please contact us at the contact information listed on the slide and we'll get you set up. In addition, if you need any help finding the resources referred to during this presentation or any other resources, please contact us. Finally, some frequently asked questions on the credentialing section of the application appear on this slide. The first question is, who should appear on the credentialing list? And the answer to this question is that all health center practitioners, employed or contracted, volunteers, and locum tenens or temporary practitioners at all health center sites should appear on the credentialing list. Second, should employees from the past year or current employees appear on the credentialing list? Health centers should include on the credentialing list only individuals who are currently working at the health center at the time of submission of the application. If you have any questions on the deeming process or the application process, please contact HRSA at the contact information on this slide.